Transabdominal ultrasound. Legal disclaimer. Information is for general and educational purposes only. Content is not nor intended to be a substitute for professional legal or clinical advice. While we strive to make the information as timely and accurate as possible, we make no claims, promises, or guarantees about the accuracy, completeness, or adequacy of the information contained and expressly disclaim liabilities for errors and omissions. At the end of this session, participants will be able to verbalize the importance of transabdominal ultrasound. You'll be able to verbalize what is transabdominal ultrasound and what it entails. You'll be able to verbalize the difference between transabdominal and transvaginal ultrasound. You'll be able to verbalize the risks associated with transabdominal ultrasound. You'll be able to verbalize the benefits of transabdominal ultrasound over other types of ultrasound. And you'll be able to verbalize how transabdominal ultrasound is performed. So transabdominal simply means through the abdomen. This topic is important because ultrasound is a non-invasive tool that we use to visualize inside the patient's body in real time. It's safe, painless, and non-ionizing alternative to X-ray imaging, making it suitable for all age groups, including children and pregnant women. It's rapid and cost-effective diagnostics. Transabdominal ultrasound offers immediate results, enabling prompt decision-making regarding patient management and a wide range of applications. It can be used to visualize numerous abdominal organs, including the liver, gallbladder, kidneys, pancreas, and others. Minimal complications. There's also very minimal complications such as low risk associated with a transabdominal ultrasound. They're negligible, mainly consisting of minor discomfort from pressure and having a full bladder. Reduced radiation exposure compared to CAT scan and X-ray. Ultrasound eliminates concerns about cumulative radiation exposure. Guided interventions such as ultrasound guidance for biopsy procedures, drain placement, and other minimally invasive treatments, and pregnancy monitoring. Transabdominal ultrasound plays a crucial role in prenatal screening, monitoring fetal development, and identifying congenital anomalies. So what is it? Transabdominal ultrasound involves placing an ultrasound transducer over the abdominal wall to visualize internal organs and structures. It's widely used for evaluating the liver, gallbladder, kidneys, pancreas, and other abdominal organs. Transabdominal ultrasound do not expose individuals to ionizing radiation and carry minimal risks, primarily related to discomfort from pressure exerted during the procedure. There's different indications for transabdominal ultrasound, such as cholecystitis, looking at the gallbladder, intra-abdominal free fluid, abdominal aortic aneurysm, hydronephrosis, assessment of the liver, gallbladder, kidneys, pancreas, and other abdominal organs. Contraindications for transabdominal ultrasound are rare, but care must be taken not to scan over wounds or incisions to prevent contamination and infection. So transvaginal versus transabdominal. Transvaginal and transabdominal ultrasounds are two different imaging techniques used to visualize pelvic organs, each with its unique characteristics and applications. Transabdominal ultrasound provides a wide view of the pelvic organs, while transvaginal ultrasound offers greater detail in a smaller area. Transabdominal ultrasound involves placing a transducer over the abdominal wall and using gel to visualize organs such as liver, gallbladder, kidneys, and bladder, and pelvic organs. Indications commonly used in the emergency department to evaluate for intrauterine pregnancy, cholelithiasis, free fluid, abdominal aortic aneurysm, and hydronephrosis. There are many advantages, one of them being it provides a wide view of the pelvic organs. Patient position, the patient lies on their back on an examination table. Transvaginally, approach is a little different. It's done by inserting a wand-shaped transducer into the vagina to visualize the uterus, cervix, fallopian tubes, and ovaries. It's used to assess conditions such as uterine fibroids, endometrial polyps, abnormal bleeding, fertility issues, ovarian cysts, and pelvic infections. Advantages: it provides greater detail in a smaller area. So technically are going to be closer to these organs because you're within the vaginal canal and you're in a closer proximity. You don't have to go through a bladder to get to the organs. They're right there. So the patient position, they lie on their back with their feet in the stirrups. So just minor little differences between the two. Risk associated with transvaginal ultrasound. Transabdominal ultrasound is little to no risk. There may be some associated discomfort when pressure is applied during the procedure, and individuals may experience discomfort from having a full bladder or lying on the examination table. Minimal and generally well tolerated. No known harmful effects of pelvic ultrasound, and unlike X-rays, there is no radiation exposure with these tests. In rare cases, care must be taken not to scan over wounds or incisions to prevent contamination and infection. There are many benefits to transabdominal ultrasound. It's less invasive than other types of ultrasound, such as transvaginal. It's less expensive and more widely available than other imaging modalities, such as CAT scans or MRIs. It does not expose patients to ionizing radiation, making it a safer option for repeated imaging. Provides a wide view of the pelvic organs, allowing for quick visualization of multiple structures. And finally, it can be used to effectively rule in or out specific pathologies such as cholecystitis without the need for further imaging. How is transabdominal ultrasound performed? Well, during a transabdominal ultrasound, the patient lies on their back on an examination table. A gel-like substance is applied to the abdomen. Ultrasound transducers, which is a small handheld device that resembles a microphone, is then pressed firmly against the skin of the abdomen and moved across over the area being studied. Images of structures are displayed on a computer screen, and images are recorded for the healthcare record. If blood flow is being assessed, the patient may hear a whoosh, whoosh sound when the Doppler probe is used. Compared to other types of ultrasound such as transabdominal ultrasound is less invasive, less expensive, and more widely available. It also does not expose patients to ionizing radiation, making it a safer option for repeated imaging. In conclusion, transabdominal ultrasound is a non-invasive diagnostic imaging modality that uses ultrasound waves to visualize abdominal and pelvic organs through the abdominal wall. It is a safe, rapid, and cost-effective way of assessing multiple pathologies, and it can be used to effectively rule in or out specific conditions, such as cholecystitis, without the need for further imaging. During the procedure, the patient lies on their back on the examination table, and a gel-like substance is applied to the abdomen. The ultrasound transducer is then pressed firmly against the skin of the abdomen and moved around over the area being studied. When being compared to other types of ultrasound, such as transvaginal, transabdominal is less invasive, less expensive, and more widely available. It does not expose patients to ionizing radiation, making it pretty safe. Risks associated with transabdominal are minimal, and the procedure is generally well tolerated. Benefits of transabdominal ultrasound over other types of ultrasound include its wider view of the pelvic organs, allowing for quick visualization of multiple structures, and its ability to provide a safe and non-invasive option for repeated imaging. Transabdominal ultrasound is a valuable diagnostic tool that can provide important information for the diagnosis and treatment of various abdominal and pelvic pathologies.